if they've answered who they are and what they're doing, they're responsive already, right? That's a check. We've done that. Determine their orientation to person, place, time, and situation. So they know the person, right, because they've identified themselves, okay? You can say, can you tell me where you are? Do you know why you're here? Okay, that'll let them know, like, hey, I'm in the hospital. I'm here because I had leg surgery. And you can ask them for time. Do you know who the president is? That's usually what people ask. And, you know, if they're like, oh, well, it's Trump and I just don't know about this, you know, then we know they're oriented, right? Or they might be like, Trump for life. Okay, you're oriented. So whichever way it goes, okay? You're gonna use your pen light to assess their pupils. And guys, these are the pen lights I was telling you about, the cheapies. They actually work best because the LED ones will blind you if you stick them in light. So when you start, remember you start at the outside corner and you work your way in and then back out to make sure that the pupil is reactive and round. And then you come over to the other side and you do the other side. Okay. Pearl, pupils equal round, reactive to light. Okay. I don't see any periorbital edema. Okay, so there's no swelling underneath the eyes. The skin, can you say ah for me? Ah. Mucous membranes moist, pink, intact, no sores or lesions. Okay. So we've already done the whole first page. So I know it seems like a whole lot, but we're making quick progress, okay? We're gonna palpate the carotid arteries, okay? Do we do this? No. One at a time, go, oh, yes. Arteries are palpable, +2, or +3, whatever they would be on the person, okay? And then you say, can you smile for me? And they smile. Symmetry. I see the face is symmetrical, okay? That's letting us know, do they have any nerve damage or if they've had a stroke, okay? The next step, vital signs, you just say, I received your vitals from the CNA. They look great. That's all you have to say. You don't have to get their vitals. You don't have to do any of that stuff, okay? Then we move on to the chest, okay? Okay. I'm gonna listen to your heart now, okay? So you were kind of all looking at me weird when I was covering them all up, right? Okay, we don't want them to be naked, okay? So we want to provide as much privacy as we can. And guys, when you're listening to an apical pulse, you always want to go underneath the shirt, okay? And this goes in clinical too. It's really hard. You can hear some through a shirt, even if it's a thin shirt or a gown. It's so much easier to hear if you're right on the skin, okay? So you put your stethoscope in. I'm gonna listen to your apical pulse, okay? Remember, it is on this side, okay? In between the 5th and 6th intercostal space. I'm gonna listen for a minute. Heart rate is rhythmic and regular. Normal S1, S2, so he's got the love dove. Okay. All right, your heart sounds pretty good. Okay. So then we are going to listen to their breath sounds. Okay. How many lobes do we have on each side?
2, 3, 4.
Very good. So guys, as long as you have a system, I don't care how you go. Some people like to listen going down one side and moving to the other. I feel like it's almost better to go here and here, here and here, and then down, because you're listening to each side and you're assessing the same part of the lungs on each side, if that makes sense. Some people do it this way. It doesn't really matter. You can go either way. But if you think about you're listening for crackles or you're listening for something like that, you want to make sure, okay, I hear it in this side. Okay, but this side's good. You want to make sure that you're doing it systematically. Okay, so remember you've got 1, 2, 3, 4, 5 is the one, the lower left, okay? All right, your lungs sound good. I don't hear any crackles or adventitious breath sounds. The chest is symmetrical, no barrel chesting noted. He's breathing, his unlabored, his eupnic, okay, looking good there. No accessory muscles, no difficulty breathing. I want to check your skin turgor. Oh, it's less than 3 seconds. Remember, you want to do that over the collarbone. Okay. At this point, guys, I've listened to the front of the lungs, right? But we need to listen to the back as well, right? So what I'm going to do is ask for assistance from whoever else is in the room, which will be us. listen to your lungs on the back, okay? Okay, here we go. I'm gonna listen. Take a deep breath for me. 1, 2, 3, and 4. You only have to do 4 on the back. While I've got them turned, guys, I'm gonna look and say, you know what, his pressure points look good. I don't see any skin breakdown. There's no bruising, no ecchymosis, because you don't wanna have to flip them again when you do it. Looks good, bottom looks good. I probably wouldn't touch my patient today. Sorry, it's habit. Yeah, easy there. Nothing, no skin breakdown, skin looks good. Okay, roll back over. Thank you, assistant. Hyperflex that. Careful. Make sure his arm doesn't fall off. Okay, so now we've listened to the lungs, we've listened to the heart. What goes along with the heart? What does your heart do?
Circulation.
Oxygenation, circulation, right? Okay. So then at this point, I'm going to say, I'm going to check your pulse. I'm going to check for a radial pulse. Okay. You can do that for 30 seconds. Make sure. Okay. You've got a good strong heart. It's bounding. You're a +3. I'm going to look at your hands. Capillary refill less than 3 seconds. Nail bed's pink. Okay. Can you squeeze both my hands for me? Oh, you're really strong. Good job. Okay. So now when you're going through your steps, we've assessed the chest, we've listened to the apical pulse, we've listened to the breath sounds front and back, we've inspected the chest, we've looked at skin turgor. Okay. So we've completed all of that. Now we're going to go down to the abdomen. We want to listen to bowel sounds in 4 quadrants. Okay. Remember, your belly button is your marker. Okay, so it just makes a cross here. So I'm going to listen to bowel sounds. Oh, did you just eat breakfast? You got major bowel sounds. Good job. Oh. And we're going to listen. Guys, in real life, when you're listening for bowel sounds, is it going to be this quick?
No.
No. How long do you have to listen to a site before you say they have hypoactive bowel sounds or absent bowel sounds?
4 minutes? 5 minutes. 10 minutes.
5 minutes before you can actually chart that they have absent bowel sounds. So, guys, you're talking 20 minutes of just listening for bowel sounds if they truly have inactive or absent bowel sounds, okay? But it'll take just a few seconds. And I was like, so for this, they're not gonna have bowel sounds, right? They're a mannequin, okay? So I don't care, we're looking for the landmarks, do you know where to do? But then I have students go out in clinical and they're like, oh, yeah, they've got bowel sounds. No, they don't. I know you didn't hear anything. So make sure that you actually are listening and you actually hear the bowel sounds when you're doing it on a person. So I looked first, the abdomen is non-distended, there's nothing wrong. I listened, okay? Now I'm gonna palpate. Do you have any pain? No pain? Okay. Abdomen soft, non-distended, no pain. Okay. So we've done that, we've palpated. That's all we have to do with the abdomen. Okay. Then the upper extremities, we did the hand grips. We did the radial pulses. We want to do those bilaterally. Okay. We want to check their capillary refill bilaterally on both their hands. We want to look for edema. There's no edema to the upper extremities. And then we do range of motion. He has active range of motion. Okay. Then moving on, we want to look at the lower extremities. Okay. So now we're looking at the legs. We're assessing again, it's the same thing for the lower as it is the upper, okay? There's no edema, the skin looks good, I don't see any breakdown. There's no breakdown on the heels. He has an active range of motion, he can do everything. Can you push against my hands? Oh, really strong, good job. Check for capillary refill, it's less than 3 seconds. The toenails are pink, okay? We don't see anything, any breakdown, any skin breakdown. Guys, the most important thing you need to check is under their heels, okay? Because this is the spot that they'll typically start to break down, okay? And then we also want to come down and we're going to say, let me check your pedal pulses bilaterally. Oh, good, your pedal pulses are +2. Good job. Way to have a heartbeat. Okay. So then you look, and we've inspected the feet and ankles for edema, we checked the pedal pulses, we did the foot pushes, skin color, no edema, appropriate to raise, and we looked at their range of motion. Okay, this client does not have a fecal management system or a Foley, so we're gonna ask, when was your last bath? Yesterday? Was it, how could you describe it to me? It was brown, form, soft, just normal for you? Okay, awesome. Tell me about when you urinate. How does your urine look? I don't know, I never looked at it. Would you say it's yellow and clear? Yes, okay, great, that's normal. Okay, any cloudiness noted or any pain upon urination? No? Okay, great, fabulous. So we've asked about their urine, we've asked about their bowel movement. Okay, at this point we're looking, now we've done all of our systems, okay? So that's really not so bad, right? Now we're gonna start looking for abnormal things. Do they have any IVs? I don't see any. Do they have any stomas? Do they have any ostomy bags? Do they have a brace? Do they have a cast? Anything, are they on telemetry? Anything that's abnormal that we put there, we want to make sure we've charted, okay? So that'll be the catheters. We looked at the pressure points already, 18. We looked at the color of the skin, okay? We didn't see any surgical incisions. We didn't see any dressings. So that's it. Assess presence of tubes or equipment. Remember, that would be things like your oxygen. What do we want to check with oxygen?
Make sure it's plugged in.
Make sure it's plugged in. What else?
The right setting.
The right setting. Okay, so if I've got his chart saying his oxygen at 2 liters, we want to make sure it's at 2 liters. We want to know whether it's a nasal cannula or a mask. Okay. NG tube, there's no NG tube. Okay, pulse ox. We got that with our vital signs, right? Okay. And then our last one that we really want to make sure. Sir, are you having any pain? Oh, it's a 2. Can you tell me where it hurts? Your nose? Your nose hurts? Okay, could you tell me, is it throbbing? Is it sharp? Oh, it's a sharp pain. Your last nurse hit you. I'm sorry to hear that. So how long's this been going on? About an hour. Okay, well, let me get the abuse paperwork. And we're gonna deal with that, okay? So you said it's like a 2, and it's your nose, and it's a sharp pain. It's been going on for about 2 hours. Is there anything that makes it better? Ice makes it better? Does anything make it worse? Touching it. Okay, well, we won't touch it, and I'll go get you an ice pack, okay? Does that sound good? Okay, great. Do you have any other complaints? Or anything else bothering you? So this would be when they could tell you, like, I feel nauseous, or any of those things. I feel constipated, I have diarrhea, any of those things, which they should have told you with their bowel movement, but in case they didn't mention it then, this is a good time to get that information. Okay, well, can I get you anything else? Doing okay? All right, so I'm gonna recover up my patient. At that point, I'm gonna lower the bed. I'm gonna make sure my 2 side rails are up. Here's your call light. You can call if you need anything, okay? Is there anything else I can get for you? No? Okay. Let me get your other side rail. You'll be good to go. I'll go get that abuse paperwork started. Call if you need anything. Okay. Walk out, you can open the curtain, wash your hands.